Hi, everyone. I am Stephanie Grein, Sycle's VP of Sales and Enterprise Services. I want to thank everyone for taking the time out of their day to join the next installment of Sycle's Thought Leadership Series. Today, we will focus on two critical issues being addressed by Congress and how they may affect the industry: Medicare expansion and over-the-counter hearing aids and regulations. We have two of our most connected experts today joining us from the Hearing Industries Association, HIA, who will share critical updates and advice to clinic owners and providers. Please welcome Kate Carr, HIA President, and Bridget Dobyan, HIA Director of Public Policy and Advocacy.
Thank you. Thank you for giving us this opportunity to join your members today. As you said, we're going to be talking about some things that most definitely are changing, and that's OTC, and things that might be changing, and that's Medicare expansion of traditional Medicare to cover hearing health. I'm Kate Carr. As Stephanie said, I'm the president, and in today's presentation, I'm joined by my colleague, Bridget Dobyan, who is our frontline person on the halls of Congress. And I think you'll find her presentation on Medicare quite enlightening. We first want to give you a little bit of an overview about who HIA is, and I promise this is the only slide I'll show. Our mission is to be the trusted voice on hearing healthcare for product innovation, public policy, patient safety, and education. And so we're very aggressive in all of these areas as it pertains to not only our members, but the people who our members support, which happens to be hearing care providers, and also the consumers. Public education is a very important component for us, as it is for you. Our work includes advocacy, regulatory engagement, market research. Some of you might be familiar with our market track studies. You can find summaries of them on our website at betterhearing.org. We also work closely with partners, and we have some major educational initiatives that I'll share with you at the end of this presentation. I'd like to turn it over to Bridget, who will walk you through what's going on in Medicare.
All right, good afternoon, everyone, or I guess good morning, depending on where you are. Really looking forward to this discussion of Medicare with you all over the next several slides. We have a lot of material to cover, so I'll go ahead and just dive right in. So I think it's important to begin with really where we started, how we got to this point where we're discussing Medicare expansion to hearing services and treatment, before wrapping up with some of the uncertainties that exist within the current political and legislative landscape and what that might mean for you. So to start off, let's take a look at why lawmakers are considering Medicare expansion at all. You have approximately 62 million beneficiaries who are currently enrolled in original Medicare or in Medicare. You have 10,000 Americans who are turning 65 every day and becoming eligible for Medicare. You have an expected enrollment of approximately 80 million by the year 2030. That's certainly a large number. As all of you already know, I'm sure 1 in 3 individuals between the ages of 65 and 74 have hearing loss, and about half of those over the age of 75. The associated comorbidities of hearing loss, again, I'm sure that many of you are already very familiar with these: social isolation, depression, dementia, higher risk of falls that require hospitalization, and more. So with all of that, original Medicare has statutorily excluded dental, hearing, and vision benefits from coverage since the program's inception in 1965. So this takes us on the march toward expansion. Congress has long been interested in expanding original Medicare. Of course, there's Medicare Advantage, which enrolls approximately 42% of the current Medicare population they have the flexibility to offer those supplemental benefits like hearing, dental, vision, and wellness. But Part B Medicare, original Medicare, has statutorily excluded these items. Last Congress in 2019, the House actually took steps to pass H.R. 3, which was primarily a drug pricing reform bill, but they included Medicare expansion to hearing, dental, and vision benefits under that framework, using the savings achieved through drug pricing reform and allocating that toward the Medicare expansion provisions. That bill ultimately did not advance in the Senate, and so it died at the end of the previous 116th Congress. So in January of this year, you of course saw a change in command. Democrats have control of the U.S. House of Representatives, the U.S. Senate, as well as a Democratic president and vice president. It's important to note that these majorities are really quite narrow. In the House, the Speaker has a margin of 3 votes that she could lose and still pass legislation by simple majority. And in the Senate, you have a 50-50 split between Democrats, and that includes 2 independents who caucus with Democrats. And then you have 50 Republicans. And the vice president, who of course is a Democrat, serves as the tie-breaking vote in a split Senate. So the Senate generally requires a 60-vote threshold for legislation to advance. So to pass a package, the reconciliation package that we'll discuss a bit more over the next couple of slides, no Republican votes are expected in support of that package. So Democrats have to pursue this by a simple majority, that 50+1 vote threshold. So to accomplish this, they're undertaking the process through a reconciliation. This is essentially a budgetary tool that can bypass that 60-vote threshold that would otherwise be required and pass the legislation by a simple majority vote. So to start that reconciliation process, the House and the Senate in August passed a $3.5 trillion budget resolution. The resolution set that top line figure and also provided policy recommendations to the committees of jurisdiction. Committees then developed that legislation under their jurisdiction to hit those targets, those budget targets, and then return that legislation to the respective budget committees to be bundled together for ultimate floor consideration. So the House completed that step back in September. The package was held for a while due to disagreements over timing, as well as the total top line figure. So in October of 2021, recognizing that there were those intra-party conflicts over that ultimate top line figure for this broader package that not only includes health policy provisions, but tax policy provisions, as well as climate provisions, the White House and congressional leadership negotiated a lowered top line number down to $1.75 trillion to get more moderates on board and still attempt to pass this package. That same day, House Democrats released a revised reconciliation bill to meet that lowered $1.75 trillion figure. Initially, it included Medicare expansion to hearing, dental, and vision, but to hit that lower number, they dropped dental and vision and are only pursuing Medicare expansion for hearing benefits currently. Additional changes were introduced on November 3rd. That was a slight change from the October text. And then the House is expected to consider the reconciliation package by the end of this week. The end of this week is, of course, tomorrow, so votes may be coming tomorrow night, possibly into Saturday, to advance that legislation. So I mentioned the narrow majorities. I just want to spend a quick moment to discuss who's really driving this reconciliation bus. The White House has become significantly more involved in the overall process to pass this reconciliation package. Over in the Senate, as I already mentioned, it's a 50-50 split. Senators Manchin and Sinema. This is a process where really one senator can stop the bill. So they remain as 2 key moderates, really crucial to this entire package. And then in the House, of course, as I already mentioned, the Speaker can only afford to lose 3 votes and still advance legislation. So the point here is really that every vote matters in both chambers, as again, no Republicans are expected to support this package. So now that we've kind of dispensed with these procedural aspects and these vote aspects, let's talk about the substance of Medicare expansion. So under Medicare expansion, how do we make it meaningful? So in front of you are the priorities that HIA has been advocating for with congressional leaders, with members, and with staff. So access, of course, access to all licensed hearing care professionals to provide services within their scope of license under state law. This would include physicians, audiologists, and hearing aid specialists. Device classification, this would be the appropriate and accurate classification of hearing aids as prosthetic devices. This is distinguishable from durable medical equipment and really takes into account the need for adjustments and customization as opposed to the off-the-shelf approach of most DME products. Competitive bidding, crucial to avoid the race to the basement that comes with the competitive bidding framework. And then beneficiary choice. This supports the beneficiary and their ability to choose the device that works best for them in consultation with their hearing care provider and pay any difference in cost above the Medicare covered amount, of course, with appropriate notice and disclosures. So that's really our foundational stance on how Medicare expansion could be undertaken in a meaningful and impactful way. So we have text from the House. We don't have text yet from the Senate, but the November 3rd text is the most up-to-date version that's currently under consideration in the House. So I'll run through what's been included. On the device side, hearing aids are classified as prosthetic devices. There is an exemption from competitive bidding when these devices are provided by a physician or other practitioner, and that would be determined by the secretary to their own patients as part of their professional service. Covered once during a 5-year period for diagnosed moderately severe, severe, or profound hearing loss. And this is actually a change from previous versions of the legislation that would have only covered severe or profound hearing loss. For devices determined appropriate by the secretary and also furnished pursuant to a written order from a physician, audiologist, hearing aid specialist, or other practitioner. On the services side, the bill does include audiologists, and then again, in a change from previous versions of the bill, the October 28th version and the November 3rd version of the bill actually do include hearing aid specialists, both as practitioners, and then also included a provision to increase access in rural and underserved areas. And the text provides an effective date of January 1st of 2023. This was bumped up from a previous proposal that had an effective date of 2024. And so with this, I'll note that there is a lack of clarity in some of these legislative provisions. Now, that's not necessarily unusual. Congress doesn't necessarily have the in-house technical expertise to develop every detail of the program. And agencies do have that in-house expertise and are generally more prepared and able to move quickly and nimbly to implement the specific details under that broader legislative framework. I'll take a moment to discuss that agency authority. The previous slide, it noted that early implementation date of January 1st of 2023. And it implements the program by program instruction. Now, this is essentially a sub-regulatory process, so it doesn't follow that full public and notice comment period that is generally followed under a longer rulemaking process, something like Kate will address in the OTC section. So this has the potential to leave stakeholders fewer opportunities to be involved with or to provide feedback on the process and the program parameters. Again, this bill as drafted does grant significant authority to the Department of Health and Human Services and to the Centers for Medicare and Medicaid Services, so HHS and CMS, to really develop the specifics of these programs. And so, within program instruction, it's important to get in there quickly with the specifics of how these programs should operate to be beneficial, not only for the participants, for Medicare beneficiaries, but for the professionals who are providing these services and treatment as well. A couple things that are actually pulled out in the bill. One is the 85% reimbursement rate. So this would be for audiologists and hearing aid specialists as practitioners. They would be reimbursed at 85% of the physician fee schedule. And then again, under Medicare's payment policy, there's an 80-20 split where Medicare is responsible for and covers 80% of that Medicare covered amount. And then the beneficiary would be responsible for that remaining 20%. So let's talk a little bit about the odds of this bill actually becoming law now that we've gone through the substantive pieces, again, that we know from the House, and the Senate may have slightly differing provisions. So it's anticipated that the House will pass the reconciliation package tomorrow or possibly Saturday once they get the full CBO score, the Congressional Budget Office score. The full score has been promised from CBO by tomorrow. We did just see that the hearing provision was released today and scored at, I believe it was $36 billion, which is consistent with a previous estimate that was issued. There are some things that are unresolved with the bill still that leaves the fate uncertain in the Senate. Again, there's that very tight vote margin, so priorities of every senator really comes into play. So some of those resolved or unresolved items that may be causing some heartburn over in the upper chamber include Medicare expansion and how limited it has become. So again, it was initially proposed as hearing, dental, and vision. This has been a priority of Senator Bernie Sanders, who is the chairman of the Senate Budget Committee. The House dropped dental and vision from consideration, so it's a question as to how hard he will push to possibly include those other two benefits, and if that causes enough heartburn for him to slow down progress on the bill. The House also made several additions to the overall package that just might be unpalatable or unworkable in the Senate, both from a policy and a procedural position. So, for example, inclusion of paid family leave that garnered support in the House, but Senator Manchin, who is a recurring theme throughout this process, has said that it does not belong in this bill. And then procedurally, the Senate must contend with the Byrd rule. This requires that under reconciliation, the provisions that are included must have more than an incidental budgetary impact to remain in the bill. So the process of scrubbing the bill for these budgetary impacts, that's called the Byrd bath, and it's expected to change the bill the House is expected to send over. So once if the Senate passes this bill, it would have to go back to the House for another vote. Again, scoring, which I had just mentioned, that's a remaining consideration. And then key players, no surprise here that leadership is really steering the ship. There's been intra-party conflict in the House between moderates and progressive that largely stemmed from the twinned infrastructure bill that has since been dispensed with and signed into law. And then, of course, we can't forget the outside political and economic environment. We have looming elections in 2022 already. Members are acutely aware of that upcoming deadline and whether that has an impact on timing if this bill keeps getting pushed out. And then there are economic factors that may impact passage of the bill. Inflation, this is something that's been cited by Senator Manchin as a reason to slow down on consideration of the bill. What I can't emphasize enough throughout this process is that it is remarkably fluid. There are a lot of things still up in the air. So I'll just hit this timing slide very quickly. I'll shift over to what this may mean for your practice before I turn it over to Kate to discuss OTC. So the House is again moving through the process quickly. A vote is anticipated the end of this week. The Senate's expected to take longer, although the Senate Majority Leader has voiced a preference for considering this package before the end of the year. There are other competing priorities that make December particularly dicey and busy for lawmakers. That includes the expiration of government funding. There's also a debt ceiling fight looming out there as well, and a few other priority pieces of legislation. So what might all of this mean for you? At the top of the list, of course, potentially more patience as coverage is rolled out in 2023, again, if the bill passes and is ultimately signed into law. And this will really be a new landscape for everyone. There are diagnostic audiology codes under Medicare, but it'll be a new frontier for hearing aid specialists. And what does that process look like under a sub-regulatory process with program instruction and really a one-year timeline to develop the details of this program? There are also implications that continue to come up for providers currently under Medicare and how far those would extend to new practitioners like audiologists and hearing aid specialists for these newly covered services and treatments, such as the Sunshine Act. And then with any new program and expanded services, there will be growing pains, both for professionals and then helping beneficiaries really understand those benefits. On the device side, appropriate devices will be determined by the secretary. What level and at what payment, again, that is something that is expected to take place through that sub-regulatory process and really handled by CMS and not something that would be spelled out in the legislation at this juncture. So again, I remind everyone, this is a very fluid process. Nothing is set in stone with Medicare expansion or with reconciliation. And even if it passes, a lot of those details are expected to be addressed at the agency level by CMS and HHS. So while it feels like it's already been a long road on these issues, there is still a lot to tackle in the future if this should pass. So with that, I will hand it back over to Kate.
Now I'll say thanks again. Great presentation. And for those of you who are posting questions, Stephanie will help us at the end come back to reply. Today, I want to talk about what is definitive. At least we do know that the law passed and the regulation is currently under consideration. And we're going to talk about all of that with regard to OTC. Next. Just a review of what happened and when. In August of 2017, the law was signed, and it, as part of the FDA Reauthorization Act, and it directed the FDA to create a new category for OTC hearing aids and issue those proposed rules by August of 2020. Well, we know that the FDA missed that deadline, due in part to all of the demands of COVID on the agency. The law requires the regulation to direct that this be intended for those who are 18 years and older, so not for kids, for adults, for perceived mild to moderate hearing loss. And the word perceived is important because people can buy them without the advantage of a hearing test. The use of the same fundamental technology for hearing aids was also included in the legislation. Allow the user to control and customize the OTC hearing aid to the users, the end user's needs. You could or could not use wireless technology or include tests for self-assessment of hearing loss, and be available without the assistance or intervention of a licensed person, meaning you could buy it in person, by mail, or online. Next. The timeline, the FDA missed that August of 2020, and so in July of this year, President Biden issued an executive order that was far-reaching, but one of the things that got a lot of attention was his direction to the Health and Human Services Department to release the rule within 120 days. As part of that, the OMB always has a role in reviewing the rule, and they received it and sent it back to FDA in October. On October 20th of 2021, the proposed rule was published in the Federal Register. So where are we now? We're in the midst of a 90-day comment period where anyone can submit a comment to the FDA. All of those comments are posted online, so there's complete transparency about comments. Once that window closes, and it's expected to close on January 18th, the FDA generally takes about 6 months, 180 days, to review the comments, to make any changes, to write a preamble, and to obtain all of the sign-offs that have to go through both the agencies as well as the executive offices. So when that happens and that's completed, it'll be published in the Federal Register, and we're expecting, and I believe that it is included in the proposed rule, that there'll be a 60-day effective date after the publication. So if everything goes by this timeline, we're looking at September of 2020 when we think the rule will be in place. Now, remember, there will be regulations regarding devices that could require a 510K or other things. So it's not clear if we'll see sales immediately, but we could. And we could also see the agency either go faster or slower. Next. Their goal in creating this proposed rule, as you see on this slide, and this is directly from the FDA, in creating a regulatory category for OTC hearing aids and amending the existing rules, which the proposed rule does with regards to what are now referred to as RX hearing aids. We intend to provide reasonable assurance of safety and effectiveness That's the main charge of the FDA for these devices, as well as to foster access to and innovation in hearing aid technology, thereby protecting and promoting the public health. The FDA's job is safety and effectiveness, and that's something that we are paying a great deal of attention to. In 2018, the four major professional groups, AAA, ADA, ASHA, and IHS, as noted on this slide, came together and they released a consensus paper that they provided. It was directed to the FDA, and it contained their recommendations for product requirements, specifically looking at output and gain. Output at 110 decibels, gain at 25 decibels. Outside the box labeling, making sure that we definitely see a requirement that you have to be 18 or older, and that it was recommended by the professional groups there be a notice about hearing loss being a medical condition that's best addressed in consultation with a licensed professional. Inside the box labeling, which we all know how much the normal consumer will read all of this labeling, but it still is important to have that labeling there. A warning about not using it for children, an instruction manual, comprehensive language about the labeling and intended use. In terms of risk classification, we pay a lot of attention to something that impacts our members and the manufacturing side, which is the 510K exemption or requirement for devices that are going to the market first time. And then consumer protection is another key area. As you know, while the FDA regulates devices, the licensing and of professionals and sales are all done at the state level and vary from state to state. So we wanted to make sure that federal law, which could preempt state law, does no harm to the consumer. There's a lot in this consensus paper. You can find it online if you're interested. HIA did endorse these recommendations, and they'll be highlighted in our comments to the FDA on the proposed rule. I'd like to go through a couple of slides that dive a little deeper into what is in the proposed rule as it compares to the consensus paper recommendations. With regards to product requirements, the consensus paper wanted a definition of moderate hearing loss at 55 decibels. Now, this is different than the World Health Organization definition of moderate hearing loss. In fact, the FDA does not put a definition for hearing loss in the proposed rule, and that's something that we will certainly address. Output and gain at 110/25, no. Output at 115 decibels with the ability to go up to 120 decibels if there is input compression and volume control. Now, 120 decibels, for those of you who do this work every day, you know how loud that is. And the FDA specifically cites that they think consumers in less than 30 seconds can take the device out of their ear and will have the mobility and flexibility to do this if the volume is too loud. No limit on gain, which is causing some concern in the audiology and I should say in the hearing care professional field. And the fit as defined, which I'm sure 3 years ago, 4 years ago, I didn't know anything about healthcare. And I can tell you today, I'm not sure I could find that bony portion of the ear canal to insert my new OTC product, should I have one. A lot of confusion for consumers about things that they don't quite understand. Next slide. In terms of the outside of the box labeling. So this again is an important part because consumers will be able to go to their local pharmacy or to a big box store and make a decision. And their decision will be about their perception of their hearing loss and whether this is going to be right for them. And hearing is getting a lot of attention now, given Medicare expansion and the upcoming OTC final rule. So will people understand the intended use? And the consensus paper made some recommendations regarding that. And again, that it's a medical condition. So in the FDA proposed regulation, they do intend on outside of the box that there be an intended user label, the symptoms suggesting mild to moderate loss, warnings about red flag conditions and what to do, when to seek the advice of professionals, and a web link to the instructional brochure, which is probably not going to fit in a package that contains OTC products. Now, in terms of return policy, I'm going to come to that later on in my presentation. Next. Inside the box, again, the proposed regulation, I'm going to focus on that. Who are the intended users? That it is not hearing protection. So it is a hearing aid device, not a PSAP. And we have new PSAP guidance as well, as you may well know. How to report adverse effects, and the FDA cites the creation of a website that will be available for consumers. Again, when to seek advice on professional services, what are the technical specifications that will be important, but probably not terribly understood by the average consumer. A caution about excessive sound output, important, particularly given the lack of gain here. Instructional brochures, and more. There's a lot of information if you look at the 114 pages of the proposed rule that we'll be making comments on in this area as well. Next. Consumer protections. As I said earlier, they vary from state to state. But we want to ensure that there is a really solid return and refund policy. That's important. It's a protection for consumers, particularly consumers who are, again, perhaps operating with more knowledge about the degree of their hearing loss, but probably not. This is intended for people to do it yourself. The proposed regulation does not require any specifics about returns, refunds, trial periods, other than the company to note that they have them or they don't have them. So again, another important area. Preemption is, my colleague Bridget has done an extensive amount of work on the preemption, looking at the state laws, all 50 states plus the District of Columbia, to understand where there are warranty protections, refunds, just a whole host of issues. And so this is another area where we'll be diving deep into this in terms of comments, so that the intention is that this new rule will not preempt generally applicable requirements or professional licensing or regulations. But language that's in here regarding preemption is something that we're closely looking at, again, to both make sure that we don't upturn all of the professional licensing regulations that are in place in various states, in all states, but also that we ensure those strong consumer protections remain in place. So what does this all mean to you? And, here Bridget and I sit and we work in Washington, D.C. We think about advocacy. We talk to people. I met with, ASHA is holding its meeting here in D.C., just a few blocks from where I live. And I met with an audiologist who has been in practice for 30 years. And her reaction to this was, I am really excited about what's coming. What hearing aids are like today as compared to what they were like 30 years ago, you can't even compare them. So this is change that's coming, and change can be hard. So while she is excited about the change and what it means, maybe not everybody is excited about the change. Next slide. So we know that in some ways, even from when this law was passed in 2017, we didn't see Olive or Lively or Eargo or Lexi or New Hearer. This channel, which was the direct-to-consumer channel, allowing people to purchase hearing aids, perhaps with some assistance, as in the Lively model, from a hearing care professional, or perhaps not. The Lexi ads that I've seen, their advertisements are, you can do this on your own. So we've already seen direct to consumer really in there. And in fact, I'm hard pressed to say what's the difference between what's referred to as direct to consumer and not regulated by FDA and OTC, which is a device categorization. Now, in that intervening time, the FDA also approved the Bose self-fit hearing aid. These are important to look at because self-fit, the definition of self-fit, is a little murky in the proposed rule. And that's one thing that we want to get clarity about. What is the difference between self-fit versus OTC? How does direct-to-consumer fit into this or not? Does direct-to-consumer really fall away and products become classified as OTC products if they're sold directly to a consumer? So for the average person, there is a tremendous amount of confusion, whether it's state attorney generals hearing from consumers and issuing warnings about OTC, direct to consumer, a lack of enforcement of the existing regulation, companies advertising fake registration certificates. As I said, OTC products that are here. We have a number of different things. We have Medicare expansion, we have PSAPs. How do people figure out what to do? And I think whether they're coming to you and confused or not coming to you or waiting for an OTC product or thinking that a PSAP is going to do the same job as an OTC product, or thinking they'll have Medicare coverage and they only have moderate hearing loss, it's going to be tremendously confusing if all of these things come out and collide. And it already is confusing. We hear a lot of questions in the education work that we do. Next, Bridget. So we wanted to offer some thoughts for you as it pertains to your practice and how to think about your value and what you're probably already doing in terms of starting now. We know because through our market track research that the hearing rate, adoption rate has been increasing. Between market track 9, it was at 31%, and market track 10, 34%. Now, that's only 1 out of every 3 people that we survey in a survey that reaches 55,000 individuals in 20,000 households, and who report their self-perceived hearing loss or they wear a hearing aid. So that's not tremendous, but it is an increase. We also know that the satisfaction rates have become very high. Here you see that in market track 10, satisfaction rate at 83%. Well, that's better than how people feel about their cell phones, their personal computers, or their household appliances. And we want people to remain satisfied with their hearing aid. That's important because if people get a product that they're not happy with and it drives down satisfaction, it impacts the larger population. And so important that we get these regulations right so that we can make sure that people get the right product, the right device for their unique hearing loss that they need. Now, we have so much data in market track and we're not showing a whole lot of slides there. We could, but we're not. But when you look at how are people, are they happy with their hearing care professional? Are they satisfied? When you combine here, great deal and moderately, that's 90% of people. That's extraordinary that many people are happy, and that 69% of them say they're a great deal happy. And we compared that to how people felt when they purchased their PSAP. And we used PSAPs when we launched the 2018 survey as a point of comparison, since we didn't have OTC and we wanted some answers that could fit a potential OTC product user in the future. Well, 38%, more than a third, said they would have benefited a great deal if they had seen a hearing care professional. or moderately, 28%. So you're talking about a majority here of people who are looking at a product and have purchased a product who then think like, I could have done better if I had some help. There's something there for you to think about in your practice in terms of how do I reach that person that's trying to make a decision and would benefit from a little bit of counseling as they're making the decision about which way they're going to go. We show this slide and tip our hats to Kim Cavett. We found that her look into the crystal ball, as she put it, offered some good advice for those, and specifically directed to audiologists, but I think it applies to both hearing aid specialists or dispensers, depending upon the terminology that you use. And her suggestions, and we echo them, are to become engaged in advocacy and engaged in what we're doing, to experience and learn about new technologies, to evolve your care and your delivery models so that you're in step with the changes that are happening and are expected to happen in the short term, to reconfigure your practice focus on that patient care and your particular expertise, to know your value. Kim is a big advocate of transparent pricing structures as compared to bundled costs, and to follow science and continue to learn. I guess I want to emphasize here on this point how important it would be if you have a look at the OTC draft regulation and make a comment. It could be a comment if you're feeling strongly about I want to comment on output and gain. We're seeing a lot of comments on the public site for that. Remember that comment period closes on January 18th. And the other thing that we are stepping up is our work to address the consumer confusion that I highlighted earlier. We have a campaign that is already underway, and it has some resources that you could download as soon as this webinar is over, or even while we're doing the webinar. HearWellStayVital.org is our campaign to increase education and awareness about hearing loss. It is not branded with HIA's logo. We have partners with 7 other organizations, including the professional groups and consumer groups. In there right now are active videos. There are 6 of them that you can download in either 15 or 30 seconds. You can post them on your social media. You could display them if you're in your office, if you have that capability. You can share them on email. This is really about how do we reach that next person that needs to walk into the door to get some hearing health care. For social media, we know from Market Track that our audience likes to live on Facebook. And so to make life easier for people and to spread a strong, consistent message, we have social media tiles. This is some examples of them. There are numerous ones that are in there, and they're all included in our social media toolkit. Here's a picture of it. And these have cut and paste messages. Like, we know you're busy doing the work that you have to do. And if we can speak with one voice to get consistent messages out, we'll do a lot to change outcomes for people, to improve their quality of life, to bring people who have suffered from a hearing loss and not done anything about it. And I think we all know someone like that. I have a few brothers who fall into that category. We want to give them the information that they need to make a decision. And at the same time, perhaps shorten the time that it takes between when a person perceives their hearing loss and when they do something about it, 6 to 7 years. So those are the materials. That campaign is also we have it as a national PSA. This just shows you how this is, okay, I'll admit it, I'm bragging a little bit. We launched this campaign. We've had 2 segments: Preserve the Passion, Keep Life Going. You'll see here that in the first wave of them, which is to the left, we had 26,000 plus airings at a value of 2.6 million. I was going to be grateful if it was 1 million. We launched the second campaign, and we only did 3. And we just launched the latest tranche of 3, but that one's at over 60,000 airings around the country in good day parts. We do have some of the nighttime airings, but we're even in prime time for a little bit. But these are good showings of our spots. And so far, when you combine those two numbers, we're going to pass the $10 million mark on earned media value this month. And that's just the beginning. We'll be launching a new campaign next year. All of these assets are free. They're available to use. We want to encourage everyone to take part in a message that has to get out there to expand knowledge to the consumer about the importance of hearing health. And on that, I'll say thank you, and we're ready for some questions.
Thank you so much, Kate and Bridget. For our attendees, if you do need to drop, we will send out a video recording. We are going to stay on and go ahead and answer questions. Special thanks to Kate and Bridget and the HIA. We really appreciate the information and the continued education here, and really appreciate you supporting Sycle's Thought Leadership Series. All right, so I think we should start off in the beginning with you, Bridget, and go back to some of the questions we have with the Medicare expansion. Before we get to that, though, there have been lots of questions about sharing the content. Kate, is there somewhere our attendees can go and actually download this presentation? It comes with so much valuable information. It sounds like a lot of people would like to read it and absorb and reference it later.
We'll be happy to provide the slides to you so that you can make them available with the recording, if that would be the best thing to do, I think.
Thank you. So everyone, we will send out these slides along with the recording. Now over to the Medicare expansion questions, Bridget. One of the questions was around the benefit. Is it for monaural or binaural coverage?
It would be binaural, so 1 hearing aid per ear every 5 years.
Perfect. And as far as the maximum reimbursement allowed, is this similar to other insurances? I think there was a slide that said 80-20 for Medicare. Is that going to be up to $2,500 with an upgrade option? Or can you explain that a little bit further? Yeah,
that would be the $1 million question, or I guess the $2,500 question. The bill does not specify what the reimbursement amounts would be, nor does it place a cap within the statutory text or within the legislative text. It's obviously not statute or a law right now. The reimbursement and payment rates would be addressed at the agency level, so by HHS and CMS.
And those reimbursement rates, are those only for the hearing aid codes, or will those also be for physician fees and diagnostics?
Yeah, so obviously devices are not currently covered under Medicare, so they'll be developing the entire system for that. Again, a question for the agencies and what would be handled through that agency process and regulatory process would be determining the services, what codes already exist, if new codes need to be created, again, given the inclusion of hearing aid specialists as proposed under the House legislation as well. So I do wish that I had something more specific and concrete to offer, but a lot of these questions will just be handled by CMS, and we'll be engaging at that level. We of course anticipate that the professional provider organizations would also be engaging at that regulatory stage as well on those services reimbursement rates and ensuring that the codes cover the necessary services to accompany hearing loss treatment.
Perfect, thank you. And finally, for the hearing instrument specialists, can they start the process to join Medicare as a provider, or will they need to wait?
Well, nothing is law right now. So they would, of course, have to wait until the program is developed by the agency, and the agency would be determining what the process would be for as far as certification or registration, because that's actually it's creating a definition for qualified hearing aid professionals, which doesn't currently exist within the Social Security Act. So it's creating that new definition. The Secretary of HHS has the authority to determine what the educational or certification requirements would be for a hearing aid specialist to participate within the program. So they would have to develop that, and then the enrollment process would begin.
So like you said before, everything's a bit fluid right now. So definitely.
Very much so. Yeah. The details are really being ironed out, or are expected to be ironed out at the agency level. Again, that's not necessarily uncommon within statutory construction. Congress isn't necessarily in the best place to move quickly or address each small detail of each one of these programs. And so that's why they delegate to the agency. And so really what this legislation does is provides that framework for the inclusion, of these new providers, of these new practitioners, of a new coverage for devices within the Medicare framework, and then gives it to CMS and HHS to really develop the specific parameters of the program, given their technical expertise in the space.
And a question that just came in about why are the Republicans not expected to support this package? With the hearing aid manufacturers updating the software every 2 years, why are we waiting every 5 years to reimburse the new hearing aids?
5 years would be a program cost consideration provision. If you look to the different Medicaid coverage options from state to state, the average is around 4 years or 5 years. So that kind of exists in other programs. So there's the potential that they're drawing from examples that are already out there, as well as what the recommendation would be for an upgrade as well. To the part about why Republicans are not supporting this package, as I noted earlier in my presentation, this is a huge legislative package, and it encompasses not only health policy provisions, but climate policy provisions, tax policy provisions. So on a lot of those other items, there's disagreement between Democrats and Republicans as to what should be included, what should be changed. And so that kind of speaks towards why Republicans would not be supporting this package, and why they're pursuing it through the reconciliation process instead, which would only require that simple majority vote in the Senate.
Great, thank you. I think that is, one more just came in on your topic. We have an attendee that is not currently a Medicare provider, but they are considering it. Can we send some information as to where they can go to find out more information on becoming a Medicare provider?
I would suggest that they look into the professional provider organizations for that specific enrollment. I know that they offer resources on that. We're a bit more focused on the device side. And Kate, I don't know if there's anything you'd like to add to that question, but I would recommend checking with your professional provider organizations.
And also looking at cms.gov, the Center for Medicare and Medicaid. They have a lot of information on there. You could do a quick search and find some information.
Sounds good. Thank you. Kate, let's pivot over to you and some of the questions that are coming in about OTC. The first one is, you mentioned that people can provide comments on OTC for a proposed period. Can you remind us where they go to put those comments?
I knew this question would come up, and I have it bookmarked on my computer, which means I don't have it bookmarked in my brain. But that's a site. Bridget might have it handy, because we both look at it on a regular basis. It is at FDA, but it's helpful if you have the exact provision. So by the end of this, we'll have it, and we'll make sure that it goes out in the information to your listeners.
We can definitely include that in our email when we send it out.
Yes.
All right. So For OTC and DTC hearing aid companies, can they join HIA? And if so, have they?
We have had conversations with some of the DTC companies. We've not had any of them join at this point, but we do entertain those conversations and those and have a dialogue around it for all of our members. We do have membership criteria and some policies that we ask everyone to follow. And so we have a conversation about that, but we welcome that conversation.
Great. As far as the Bose OTC or the Bose self-fit hearing aids, are those FDA approved?
Yes, they are.
They are? Perfect. And based off of the research done so far, would you be able to anticipate a range on how much the pricing of hearing aids may be changed or just due to OTCs? Good question.
There's this thing called antitrust, which means that we cannot discuss prices or pricing strategies with our members, or our members discuss it among themselves. So I can't offer an answer on that. That's one that many people ask, and market experts try to anticipate, but I can't comment on that.
Yes, and nor can I specific to pricing, but talking to our different customers here at Sycle, we have talked to quite a few customers that are using OTCs as a way to bring customers or bring potential patients in, and then using it as a lead generator to later convert those patients to a prescribed hearing aid. So hopefully we'll be able to raise awareness with OTCs and convert those to true hearing aid sales.
Completely agree with that. But just remember, OTC is not an approved category yet.
Yes.
So that's the one thing to emphasize. The Bose self-fitting is approved, but I don't think they're being sold in offices only through Bose, I believe.
So that leads into another question here. Do you think adoption rate is up from previous years?
You know, it has been going up steadily year over year as we can review data for 30, 40 years from various market tracks. Is that as a result of better technology, more attention? You know, we can't quite suss out exactly what piece is driving it. I think the improved technology has a great deal to do with it. When you look at the satisfaction rates and you combine increase of adoption, there's still a lot of people who are unaware about what a hearing aid can do, that have a perception that is still a hearing aid that my grandmother wore 30, 40 years ago. And we have to change that. We have to change that perception. That's an important thing to do, to let them know what hearing technology can offer today, particularly when coupled with the services of a hearing care professional.
Absolutely. And those companies that are selling online today, how are they able to do that without the bill being defined yet?
Well, the FDA, they're selling a approved hearing aid device. The FDA has oversight of the device, but not the sales channel. So it's a little confusing. There are some states that won't allow online sales. We got involved in legislation in Florida last year because they block it, but they have found a way around state licensure laws to be able to sell directly to consumers. An approved device, FDA currently approved device.
I really, again, appreciate the time and that you guys have put into this and sharing all of the information, not only with Sycle, but with all of our attendees. I think there is a lot for everyone to continue learning and changing with the industry on these to very critical topics in the future.
Lots of change coming, and we all have to adapt. We're in a life cycle of adapting right now. It started in March of 2020 and with COVID, and we're just all making those adjustments to what we have to do. And some of them are great. Telehealth has brought great changes, including into this field as well. And if we can adapt like that, kind of on the fly, we can certainly do better as we move forward. So thank you to everyone who was a listener. Bridget and I'll speak for both of us, really enjoyed putting this presentation together. And we hope that your members found it informative and helpful. And you can contact us at info@hearing.org if you want to follow up with any questions. Thanks.
Great. And Sycle and we'll continue updating everyone as changes happen, especially with our partnership with HIA, with Kate and Bridget. Thank you everyone for joining, and have a great day.